This is 10 News at 5.
A change at the federal level will now allow patients to get their lab test results without going through the doctor who ordered them. That's under a new federal rule, and the Department of Health and Human Services announced that change Monday. The rule was first proposed in 2011 in an effort to give patients more control over their personal health information. But some are concerned patients may not understand the results fully without checking with their doctor and getting their interpretation. The new federal rule trumps state laws, and that's important because 13 states, including the state of Tennessee, specifically ban labs from releasing test results directly to patients. Joining us with more, Dr. Ed McBride, Vice President of Clinical Services at Summit Medical Group. We appreciate you being here. Thanks very much.
My pleasure. Thank you for having me.
This is a pretty big change when we talk about health care. Put it in context for us.
You know, previously patients would contact their physician, request their results. A physician would review their record. But patients have always been but a signature away from having custody of their record. We as clinicians are the custodian of the medical record. The medical record really belongs to the consumer, to the patient.
And for a lot of people, getting tests is nerve-wracking, and then getting those results, that lag time in between the test and the results can be brutally long for people. So the fact that maybe they can get these results a little faster and themselves is advantageous in that respect.
You know, as a patient and as a consumer, I like the ability to have access to those results. I'm not certain I'm fond of simply releasing them without providing appropriate context to the result. You know, when you have a test result that's out of normal range, either high or low, without the context of what's going on in the patient's life, the patient's history, what that test was previously, it's difficult to interpret, and that's really where that relationship with that primary care provider or that physician who's ordering that study can add context and help the patient better understand the result.
Can you think of some specific tests where either one or the other is better?
You know, when you say better, if I ordered a PSA on a patient, there's a normal range for a PSA. However, the PSA has to be interpreted by the individual patient. So if it doubled in 1 year, it may or may not fall outside the range of normal, but could signify something. Likewise, if you have a single result and it's exceedingly high, doesn't necessarily mean someone has prostate cancer. Could be they have an infection or inflammation in the prostate, simply needs treatment. So we have to be cautious and not jump to conclusions when we're looking at test results.
And how important is it for people to consult with their doctors anyway when they get a test result? We were talking about how a lot of folks just want to go to the internet immediately after they see a result, and that can in itself be misleading and dangerous.
Well, it can be. You can't believe every single thing you read.
Sure.
There's a lot of good and credible information on the internet, and then there's some less than credible information on the internet. I think patients need access. At Summit, we're actually in the process of implementing a new portal which will grant Summit patients access to their test results without having to call. All they need is a portal account, and that's coming in the next few weeks, where patients can actually log in and retrieve their result as soon as the physician has verified that result, which allows that physician a little bit of time to contact the patient if there's something alarming or concerning going on without them simply getting the result.
And it's my understanding that most test results of anything you look at in the medical profession are back fairly quickly. What's that range like?
Some tests can be back same day. In fact, some of our facilities actually run tests in the office and actually have them back at the point of service. Others, it's that same day or the following day. Rarely are tests sent out. I think 80% of our studies are done in-house. 20% would be using an ancillary lab, which means we send it off and it comes back. And even the return time there is fairly quickly, within several days.
So it may be best to have a conversation with your physician or nurse practitioner to say, hey, is this test result available immediately? And if not, how can we talk about this a little bit more quickly?
I think it's always a good idea to have that conversation with your healthcare professional.
Dr. McBride, thanks very much for being here.
My pleasure.
Good to see you.